Have you ever seen a Boston Terrier tilt its head, snort audibly, and then suddenly go into a sneezing frenzy? Cute, right? But what if I told you that those little quirks could actually be signs of something much more serious? From breathing troubles to eye ulcers, Boston Terriers may be small in size, but their health challenges are nothing to sneeze at. If you're a Boston Terrier owner or thinking about becoming one, this video might just save you from future heartbreak. Stay with me as we unpack the truth behind the common health issues of this lovable, tuxedo-wearing breed and what every owner absolutely must know. Welcome back to the channel where we dive deep into everything dog-related, from breed history to behavior breakdowns and, of course, keeping your pup healthy and happy. Today, we're talking all about the Boston Terrier, affectionately called the American gentleman for its classy black and white coat and polished personality. But under that dapper appearance, the Boston Terrier can be prone to a number of health complications. If you've ever owned one, you'll know what I mean. And if you're considering bringing one into your home, knowing what you're getting into is crucial. So, let's begin our journey through the most common health issues that affect Boston Terriers, how to spot the signs early, and what you can do to protect your furry friend. Let's start with one of the most obvious issues you'll notice right away: breathing. Boston Terriers are a brachycephalic breed, which means they have short skulls and flattened faces. While that smooshed nose is undeniably cute, it can lead to serious breathing problems. This condition is officially known as brachycephalic obstructive airway syndrome, or BOAs for short. Dogs with BOAs often struggle with snorting, heavy breathing, difficulty exercising, and in extreme cases, they can even pass out from overexertion. Some owners mistake this for normal breed behavior, but it's actually a sign that the airway is partially blocked. If your Boston snores like a freight train or gets winded just from walking around the block, you should get it checked out. Surgery is sometimes required to widen the nostrils or shorten the soft palate, but even if surgery isn't needed, it's important to manage their weight and avoid excessive heat or exercise. Heat stroke is a very real danger for brachycephalic breeds. Boston Terriers are known for their big, soulful eyes. They're like anime characters brought to life, but those expressive peepers come at a cost. They're highly prone to eye injuries and disorders. Because their eyes are so prominent, they are more susceptible to corneal ulcers, dry eye, and even proptosis, a terrifying condition where the eyeball actually protrudes from the socket due to trauma. Dry eye, or keratoconjunctitis sicca, is another common issue. It happens when the eyes stop producing enough tears, leading to irritation, redness, and potential infections, and if left untreated, it can cause permanent damage to the cornea. You should make a habit of checking your dog's eyes daily. Look for redness, excessive blinking, discharge, or if your Boston is rubbing their face on furniture more than usual. Eye injuries can escalate fast, so when in doubt, always visit the vet. Next up, skin allergies. Boston Terriers can develop allergies to food, pollen, dust mites, and even household cleaning products. You might notice them scratching constantly, licking their paws until they're red and raw, or developing bald spots. Some Boston Terriers also suffer from atopic dermatitis, a chronic skin condition caused by environmental allergens. It typically starts between the ages of 1 and 3 and worsens over time. You'll see red, inflamed skin around the belly, ears, paws, and face if left untreated. This can lead to bacterial or yeast infections, turning a manageable problem into a full-blown health crisis. Treatment varies based on the cause. It might involve switching to a hypoallergenic diet, using medicated shampoos, or administering antihistamines or prescription medications. Keeping your home clean and avoiding known allergens is also key. Your dog's vet can run allergy tests to pinpoint the culprits, so you're not left guessing. Boston Terriers might be agile and playful, but don't let their energy fool you. They're prone to musculoskeletal issues like patellar luxation, hip dysplasia, and intervertebral disc disease. Patellar luxation happens when the kneecap slips out of place, causing your dog to limp or hop unnaturally. It can occur in one or both knees and ranges from mild discomfort to severe pain. That requires surgery. Hip dysplasia, on the other hand, involves an abnormal formation of the hip socket that leads to joint instability and eventually arthritis. Then there's intervertebral disc disease, or IVDD. This condition occurs when the cushioning discs between the spinal vertebrae start to bulge or burst, pressing on the spinal cord. It can cause anything from mild pain to complete paralysis if not addressed quickly. These issues are more likely to appear as your dog ages, but early signs include hesitation to jump, limping, or whining during movement. Regular exercise, a healthy diet, and joint supplements can help, but catching the signs early is crucial for long-term mobility. One health issue that many Boston Terrier owners aren't prepared for is congenital deafness. Some Boston Terriers are born completely or partially deaf in one or both ears. This condition is often linked to the piebald gene, which gives them their distinctive white markings. Deaf dogs can live happy lives, but they require special training techniques. Visual cues become more important than verbal commands, and safety becomes a greater concern, especially outdoors, where they may not hear oncoming traffic or danger. If you suspect your Boston Terrier might be hard of hearing, a Bear test brainstem auditory evoked response can confirm the diagnosis. Deaf dogs can still be fantastic companions. They just need a little extra care and patience. Boston Terriers are also at risk for heart problems, including congenital heart defects like pulmonic stenosis and mitral valve disease. Pulmonic stenosis involves a narrowing of the heart's pulmonary valve, restricting blood flow to the lungs. This causes the heart to work harder and can lead to heart enlargement or failure if untreated. Mitral valve disease, on the other hand, tends to develop later in life. It occurs when the valve between the left atrium and left ventricle begins to deteriorate, allowing blood to leak backward. You might notice symptoms like coughing, lethargy, or difficulty breathing. Routine vet checkups are key. Early detection through auscultation or echocardiograms can make a huge difference. Medications can manage the symptoms and slow the disease's progression, allowing your Boston to live a full and happy life. Let's talk about those delicate little bellies. Boston Terriers often have sensitive digestive systems. Gas is a common issue. Many owners joke about their Boston's ability to clear a room in seconds. But excessive flatulence could be a sign of food intolerance or poor diet. Other symptoms include vomiting, diarrhea, or inconsistent stool quality. This could be related to food allergies, bacterial imbalances, or even gastrointestinal disorders like colitis. Feeding your Boston Terrier a high-quality, easily digestible diet is essential. Many owners find success with grain-free or limited ingredient foods. If problems persist, your vet might recommend a special prescription diet or a probiotic supplement to restore gut health. As Boston Terriers age, the risk of developing tumors increases, especially mast cell tumors and hemangiosarcomas. These can appear as lumps on the skin or even internal growths that don't show symptoms until they've progressed. Not every lump is cancerous, but all should be checked out immediately. Early detection is your best weapon. Regular vet visits, blood work, and even imaging like x-rays or ultrasounds can be invaluable for spotting these problems before it's too late. Treatment may involve surgery, chemotherapy, or palliative care, depending on the type and stage. While cancer is a scary word, many Boston Terriers live long, full lives with early intervention. Boston Terriers are bundles of love, laughter, and loyalty, but they're also a breed that requires an informed and attentive owner. Many of the health problems we've discussed today, from breathing difficulties to joint pain and eye disease, are manageable, especially if caught early. The key is awareness. Make sure you're working with a trusted vet, scheduling regular checkups, and keeping a close eye on any changes in behavior, appetite, or energy. Consider pet insurance to offset the cost of unexpected treatments, and educate yourself on what's normal and what's not for your Boston. And most importantly, love them deeply. These little dogs have giant hearts and limitless personality. With the right care, your Boston Terrier can live a joyful, vibrant life for many years to come. Thanks for watching, and don't forget to like, subscribe, and share this video with anyone you know who loves Boston Terriers as much as we do. Stay healthy, stay curious, and give your pup an extra treat from us.